Alright, so a presentation here on edema control taping. I wanted to put this as a separate video so that you can watch this before or after tonight's session. And if you have watched it before, then you can ask some questions during the session, but we'll be limited on time during our final Zoom session tonight. So I wanted to get this theory and these slides out the way or done separately for you. So we're looking here at edema control taping, OCT. It is for this, for edema, for swelling, but it's also for hypersensitivity, whether that's at a tissue level, such as elderly, more frail skin, or whether that's more a neurological level, so issues like whiplash, dissociative disorder, or neurological conditions which make the skin more sensitive. The idea behind it is that rather than looking for compression, as is used for traditional treatment of swelling, we're instead decompression. And of course, we've mentioned decompression right from the very start. It's one of the original theories and one of the theories which still stands, and changes to that subcutaneous space is something that's been identified on ultrasounds and also in an MRI study as well. So the subcutaneous space does change. The theory and the assumption is that that helps with fluid dynamics, especially in the presence of edema, where the movement of fluid, of course, is so much more important. So with decompression combined with movement, then we've got a good situation for helping to manage the edema part of the swelling process, the inflammatory process, should I say more specifically. You'll see taping in this style. Maybe you haven't, but you may have done. It's quite visually interesting and often see it in sport. It's also used for the treatment of lymphedema as well. It consists of taking a piece of tape, 5 cm or 10 cm, and cutting it into thinner strips. There's no strict rule as to how many strips you cut, but you can appreciate that if you cut the strips too thin, you're going to be there for rather a long time cutting, and also if the pieces are too thin, it's just going to be too fiddly to apply. If you don't cut enough strips in the tape, then effectively you haven't got edema taping, you've just got tape with two prongs to it as such. So edema taping is a sensible cutting of the tape to create this fan tape. It spreads out like a fan, and you end up with application that looks like this. Why is it that shape? That's a good question. Nobody really knows. It's the way that it's been done as a style of taping since the 1970s, so it's a bit of dogma as it's just been passed down through the decades by different educators, but it's still used today, and it's still used, as I say, in sports and medical fields. The original theory was that there was a pressure differential between the bits where the tape is and the bits where the tape is not, so the gaps in between the tape, and that pressure differential could help with the movement of fluid. That is biologically plausible on the surface. However, when you apply this tape, it's usually applied with no or minimal stretch, so it's hard to appreciate how there's really much of a change in tension or enough for it to make a mechanical difference to get some osmosis going between those different pressure areas. There's another theory, and being honest with you here, that it may have been an economical way of covering a large swollen area by cutting the tape, as therefore you can have one piece of tape spreading out over an area rather than having to use twice as much tape, so that might be one reason. It also does provide, and this is certainly a very plausible explanation and something which I use in clinic regularly, is it provides a gentle sensory stimulus. Having thinner strips of tape is a much more gentle stimulus than having a big solid slab of tape over an area, and it's also much more gentle to remove as well. Peeling off thin strips is very different than peeling off a big chunk of tape. So we can think there about the sensitivity at a neurological level, or the quality of the skin as well can determine whether you use the thinner strips, the edema style taping, the fan taping that we're looking at here. But the real answer is that nobody really knows why the taping is like that. It continues to be done, and a question you may be asking now, a lot of people often do, is why not just put it on as one big piece rather than the fan taping? Absolutely, that's a good question. That's what you could do if you wanted to. However, with the fan taping, you don't always, without the fan taping, you may not get to appreciate the changes to the edema. What I mean by that is when you look at the images and you see changes to the discoloration of the skin in a pattern that shows where the tape was, if you have a big piece of tape on there, you may not see the same effects. unless there's enough swelling for you to see the area that was taped and the area that was not taped. Another reason is that the gaps in between the tape allow you to keep an eye on the skin, so if you're a bit more worried about reactions to the skin, then the gaps between the tape can just help you to keep an eye on the health of the skin in between. And then don't forget what I just mentioned about the sensitivity. So if there is hypersensitivity or the skin quality is not so good, then you can just simply peel those strips off. Okay, I'm just going to shut my window because there's a helicopter flying by. This is my 6th attempt at recording this for you. We had barking dog, children arguing again, wife angry with children, and barking dog, and well, you know what it's like. So finally we got some silence and a helicopter flies over. Helicopters are my absolute nemesis when I'm trying to record and film. I'm sure they do it on purpose. So when to use the edema control taping, whether you use it for edema, you use it for swelling, and you use it for hypersensitivity. Conditions like allodynia, for example, where the brain perceives a sensation which is different from the sensation or the stimulus. For example, allodynia would be if you were to lightly touch somebody and they felt pinpricks of pain and discomfort. That would be an example of allodynia, and you may be able to use taping in those cases. So if you've got somebody with hypersensitivity, let's say a chronic regional pain syndrome, for example, of which I've seen a few, one at the foot is one that springs to mind, it may be the case that you can't really do any manual therapy for them because their foot is so hypersensitive that any light touch and massage just becomes painful and unhelpful. However, you may be able to, and I was able to, put some tape on to this hypersensitive chronic regional pain syndrome area, and they were able to tolerate the tape, but not only that, it was comfortable for them to wear, and that low-level sensory stimulus may then be enough to allow you to apply a larger stimulus maybe 2 or 3 days later. So a low-level stimulus can be very helpful using this style of taping. So just bear that in mind, guys. Edema control taping, but don't forget hypersensitivity. This is your go-to taping as well. Let's have a look at a few research studies. I said don't put tape on the front of the neck, and I didn't say don't put tape on the face, but most people wouldn't put tape on the face. But in this study you see that they did, and that it was very helpful. We haven't talked too much about the placebo effect of taping, but I would say having tape on the face is probably the opposite. It's a bit of a nocebo, because whereas tape on your knee, you might wear that happily and gets interest from people. If you've got tape on your face, you're a little bit self-conscious of it. Whereas in this study, that didn't bother the patients. They found that the taping was particularly helpful for reducing swelling after having treatment for the facial fractures. And you can see the style of taping they've used is the edema control taping, the thin strips from top to bottom rather than having one piece that was not cut. And the thin strips would also help them to move their head easier, and give the tape would provide less restriction because the strips are thinner rather than one big piece of tape, which would be much more restrictive to movement. So if you are taping around areas that I've said generally not to tape, particularly the neck, then consider the fan taping, and I'll show you another picture in just a moment of taping for whiplash if you want to consider that and try that. This study here, they used taping just after knee surgery, and they found that in comparison to the non-taped group, it didn't make a difference for swelling or improvement in range of motion, but it did make a significant difference for pain reduction. So the very simple application of tape after knee surgery was helpful at reducing pain. Quick, easy, simple, and no side effects. This study here, looking at using tape for patients that have had an Lazarov frame fitted. If you're not sure what that is, Google it and have a look at the pictures. It's very interesting. It's an external fixator to help deal with very tricky fractures of the lower limb. And these patients often have lots of swelling and restrictions of joints, and they often have bone grafts as well. Swelling being one of the key issues, taping in this study was found to be a beneficial addition, and in the group that were taped, they found that the swelling reduced faster compared to the group that weren't taped. So taping was a helpful, simple addition. The application is really very simple compared to what we have done already and compared to what we're going to do. It's really cutting and sticking. It's a bit arts and crafts. The key thing is deciding you want to use it in the first place, but actually applying the tape is really very simple. You cut some tails into the tape, you try and make them evenly separated, just really for aesthetics more than anything else. You apply the base of the tape with no tension. You go over the area that you want to tape. You may wish to consider where the lymph nodes are as well, and tape so that the base is near the lymph nodes. There's no evidence to show that that makes a difference, and it might again just be one of those things which is being passed down by educators and doesn't really make too much of a difference. You can cross over the tapes, and I'll show you a picture in a moment, increasing the power. Again, I'm dubious about that term, the power of the fan taping over there, but you know, you can cross the tapes over if you want to. You're going to have more stimulus from that because you've got more tape, quite simply. You can have tapes in series, so you can imagine if you've got an area that's quite long and broad, it might be difficult to apply one piece of tape going all the way across, so just to make it easier for yourself, you could have a few tapes going down, especially if you want to span the tape all the way down the arm, for example. You apply the tape with very minimal stretch, 5 to 10%, that's literally paper off tension, so it's almost zero stretch, it just comes straight off the paper and onto the skin. And you can have a bit of light stretch over the target tissue if you want to, you know, it's a variable, but the idea here is not stimulus, so you don't want to be stretching this tape too much, otherwise you're creating a much larger stimulus, and therefore you probably do better using a non-fanned tape in the first place. Try to spread the tapes evenly as you apply them. It's a little bit tricky, but again, it's more arts and crafts than clinical skill. Here's a few examples of applications. Have a look at the knee application. Nope, sorry, have a look at the neck application there. One or both of those could be helpful for somebody who's got a very sensitive neck, so the WAD, whiplash associative disorder, taping can be helpful in that case. And there was a research study that found that that was the case, and I've used it in clinic a few times. If you are taping up into the neck, which I said don't do, but if you are going to and somebody has a limited range of motion, then this is the style of taping to try. It is trial and error. There is research, but of course you have to try with your individual patient to see what they think of it, in clinic, and then they can try it for a couple of days and see if they find it helpful. It's an alternative for the lower back. It can be used post-surgery. It's an alternative for other areas of the body as well, including the shoulder. Why would you do one and not the other? Well, it's really just down to preference, and you can think about swelling and hypersensitivity, but often it does just come down to your own decision as well, and you might try one and the other and see which one the patient prefers. So here's an example of the whiplash one. We don't need to think too much about putting the patient into a pain-free stretch because, to be honest, a pain-free stretch is not going to be much. They're not going to be able to achieve much movement here. So we just put them into the best position that we can, and then we apply the tape with minimal tension over the area. And when I do this, I often would just do one side rather than both sides. But of course you can do both sides. It just depends on what you're dealing with. Here's a classic example over the thigh, an area that there may be some swelling, and you can just apply what looks like the octopus going over the swollen area there. So it's good for hematomas as well. A few other applications comes in the boxes with the tapes sometimes, pretty straightforward. These are the interesting images that we see come through where you can see the crisscross pattern of where the tape was laid, and it's believed that it leads to a faster resolve of the edema, and that's what the research indicates as well. So it's believed that the visual changes that you're seeing there relate also to a faster resolve of the edema. I'm slightly hesitant there because obviously it's difficult. You would need to have like 2 equal bruises in order to measure one with tape and one without tape to see if it really did resolve faster, but that's the general clinical consensus, is that this is what's being achieved. There's certainly more work to be done on the efficacy of this style of taping, but it's been around for a long time. It's still used a lot in medical and elite sports settings, so it's definitely worth considering and trying. And in your practice, hypersensitivity, this style of taping is your go-to.